Hello, my name's Isaac Oguto, and today we have a very interesting topic about emergency contraceptive in a street name called P2. These are the drugs used to prevent pregnancy in unprotected sex when used within 72 hours of an intercourse. So today we dissect any information that you need to know, mistake commonly made by these P2 users, and a brief explanation on the side effects as far as drug abuse and misuse is concerned. Drug abuse and drug misuse still remains a problem and is actually very dangerous, and we have very many mistakes commonly made by the users who use this drug called P2, and they endanger them as far as their reproductive health is concerned. First of all, what is P2? P2 is a synthetic hormone like substance called Levonorgestrel of 0.75 milligrams, and remember this drug comes with a sachet of 2 pills, so that means that each having 0.75 milligrams multiplied by 2, that is 1.5 milligrams of that hormone like substance. Now P2 prevents unprotected pregnancy to a probability of around 84% if used within 72 hours of intercourse, but the earlier the better, if used within that means if used within 12 hours. Now these drugs works in 3 mechanisms, and one is stopping the ovaries from releasing the egg, and number 2 is preventing sperms from fertilizing the egg already released, and lastly stopping fertilized egg from attaching to the womb. And just like any other drug, these emergency contraceptives coming in very many brands have a lot of side effects, especially when used incorrectly. And that's why I stressed much more on the drug abuse and the drug misuse as far as drug consumption and usage is concerned. Now, let us dissect that information you are told about, and perhaps the common mistakes that every other lady outside there makes when using this drug. Number 1 is taking 2 pills at once. Number 2 is using pills routinely. That means that more than maybe 4 times a year, and using pills when breastfeeding, and lastly using pill when already pregnant. Let's dissect each every point with its own explanation. Now, number 1, taking 2 pills at once. This is a very wrong and very dangerous to you. Now, instructions are very clear according to the prescription that you are supposed to take only 1 pill followed by the second one within 10 to 12 hours. Like you take the first pill and then the second pill should be taken with 10 to 12 hours. Now ladies make a mistake and they take these 2 pills at once. Remember, just like I said, that 1 pill contains, or 1 tablet contains 0.75 milligrams of this levonorgestrel hormone. So when you take them 2 at once, that means you're taking or you're dosing yourself with 1.5 milligrams. Now this is very little as hormonal balance is concerned, and it will shift the hormone balance of your body, and this will actually have an influence on physiological processes like menstruation and complications. Number 2 is using pill routinely. Now if you know that you will be having emergency sexual intercourse, or perhaps unprotected sexual intercourse over time, and if you know that you are sexually active, you can actually shift or refocus or reconsider using long-term contraceptive methods, and I will name examples of them using the drug available on market like My Choice, like Microlut Microgynon, Femiplan, and we have implants and even intrauterine devices, IUDs. So this P2 is not an should not be used routinely, and that's why I stress that it should not be used more than 4 times in a year. If used more than 4 times a year, that is very bad, and that is actually what many ladies are making as a mistake. Number 3 is using pill when breastfeeding. Now although there are no significant evidence that P2 when used by a lactating mother can affect the baby, but it is actually not good bad for you, especially or as far as your hormone homeostasis are concerned, because once it shifts your hormones, then perhaps it can lead to problems in breastfeeding, milk production and so on, because these are controlled by exactly your hormones. Now, number 3 is using P2 when already pregnant. Remember, P2 is not an abortion pill, is stop pregnancy. If the pregnancy has already happened, then that means that P2 will have absolutely no value in stopping what has already started. So the more we intersect this information, the more we learn more, and we have very many side effects that comes as a result of drug abuse and drug misuse, and that will include heavy or very light menstruation, and we have also cramps, abdominal pains, and vaginal bleedings. It can actually lead to fever, dizziness, and so on. And this is very recommended or very advisable that if you notice any of the above, like I've just mentioned, you are supposed to liaise with your healthcare provider for more help and for more medical attention. So thank you, ladies and gentlemen, for listening to me on this very brief session on the most common mistakes done by these P2 users as far as their reproductive health is concerned. So thank you so much. Have a good time.